Hello. My name is Joanna Cohn. I'm the director of the Institute for Global Tobacco Control here at the Johns Hopkins Bloomberg School of Public Health, and welcome to our monthly Innovations in Tobacco Control seminar series. Let me just get the housekeeping out of the way. For the folks who are here, please make sure you sign in, and then afterwards there's lunch across the hall. So it's really my absolute pleasure to introduce today's speaker. Almost Dr. Erin Mead. We're just waiting for the conferral date in December, but Erin completed all the requirements for the doctoral program here in the School of Public Health and the Department of Health, Behavior, and Society, and is now a postdoctoral fellow at the University of Maryland in their Tobacco Center for Regulatory Research, one of the FDA Center for Tobacco Control Center for Tobacco Products regulatory centers. I had the fortune to advise Erin through the last stages of her dissertation work, and as I said, it was a tremendous pleasure. And I think Erin was able to choose a topic that's very topical and applied, so the topic of health warning labels on cigarette packs, which is a key issue for this country, which is struggling to get picture health warnings on our packs. And I think in this work, she was also able to bring together her interests in health communication and in disparities. I think there's also been that interest of hers for many years in addressing and being cognizant of the most vulnerable in our society. And she'll tell us about the work that was able to combine those two interests. And the other thing that she was able to do in this work was draw on theory to influence the questions and the work that she was done. And I think because of that has come up with some very interesting findings. So without further ado, please join me in welcoming Dr. Erin Mead.
Thank you for that great introduction. Thank you everyone for coming today. I think this is a really exciting topic, and I'm glad to see that so many people are as interested in it as I am. So this presentation is largely based off of my dissertation work, which was a qualitative study, but at the end I want to present to you some quantitative findings that were an extension of my qualitative work, and get some of your feedback on that and just present some preliminary results. So the title of my work of the presentation is Moving Beyond Fear, Exploring Perceptions of Theory-Based Graphic Warning Labels Among Low-Income Urban Smokers. To give you a brief overview, first I'll talk about the public health significance of graphic warning labels, but also of my research. And most of the presentation will focus on my qualitative study that I completed for my dissertation, and I'll share with you some of my selected findings and implications. And at the end, I'll briefly go over the quantitative follow-up study, where I drew some of my qualitative findings to test in a quantitative study, and end with some overarching conclusions. So as all of us in this room know, smoking remains a leading public health issue, not just in the US, but globally. It's the leading preventable cause of morbidity and premature mortality. In the US, most smokers do want to quit. They're very interested in cessation, but very few are actually able to stop. And we also know that there are significant disparities in smoking cessation by race and ethnicity and socioeconomic status. For example, African Americans are just as likely to want to quit as the non-Hispanic white smokers, but they're much less likely to achieve cessation successfully. And lower income and lower education smokers are also less likely to successfully stop smoking compared to higher income and higher education smokers. So there's a need to increase our cessation efforts in the US as well as globally. And one policy approach to promoting cessation are graphic warning labels. And you can see here a picture of graphic warning labels as an example. They're pictorial labels talking about warning about the health effects of smoking, and some labels also give advice about cessation. And it's a picture combined with a warning text statement. Globally, I think these are graphic warning labels, according to the most recent numbers I looked at, are implemented in 49 countries. The US has not yet implemented graphic warning labels. But in 2009, the Family Smoking Prevention and Tobacco Control Act did give the Food and Drug Administration regulatory authority over tobacco products, and that includes packaging and labeling. And the act mandated that the FDA need to use 9 specific text warning statements and develop pictures to go with those statements to develop graphic warning labels. The FDA developed 9 graphic warning labels, and they were going to implement them in 2012, but due to litigation from the tobacco company, the tobacco industries, that's been delayed. So there's a need for further research to design and test new labels to assist the FDA in designing and implementing and building the evidence and the case for the need for these graphic warning labels in the US. Graphic warning labels, the literature has shown worldwide that graphic warning labels are more effective at promoting cessation than text-only labels. So currently in the US, we are using only small text statements on the sides of the cigarette packaging warning about the health effects of smoking. And the research has shown that graphic warning labels are more effective at promoting cessation than these text labels. For example, in Australia and Canada, there is evidence that at the population level, after implementation of graphic warning labels in those countries, there were increased calls to the National Quit line in Australia and increased quit attempts and decreased smoking prevalence in Canada. So looking more closely at the causal pathway, how do graphic warning labels affect these behavioral changes? The research has shown that these graphic warning labels promote changes in attitudes, beliefs, and knowledge that's favorable to cessation, as well as increasing people's intentions to quit. In addition, the cognitive and emotional reactions to these labels are associated with some of these attitude and belief changes, as well as future engagement in cessation behaviors. So this just illustrates for you how these graphic warning labels can have an impact on behavior. However, there are some significant gaps in the literature that I was hoping to address with my study. So first, limited research has been done on graphic warning labels among low SES populations. And as we know, they have some of the highest burden of smoking in the US. Some of the limited research that's been done has suggested there might be a bigger impact of graphic warning labels compared to text-only labels among low education and low literacy groups, but further research is needed on that. And in addition to testing labels in these groups, there's a need to develop labels with these groups. That's been very limited in the research as well. Second, there's been limited research on the most effective label content. So we know graphic warning labels are more effective than text-only labels. Okay, well, which content, which types of labels are the more effective ones? So the research that has been done has shown that vivid pictures of the negative effects of smoking, which I'll show you an example of in a few slides, those are rated by smokers as most effective for making them want to quit, most effective on several different criteria. However, the research has shown that there's substantial variation. So some people will rate the non-vivid picture labels as higher than the vivid pictures. So there's a need to understand a bit further which content's more effective and perhaps what individual level characteristics might shape which labels are more effective for which populations. There was a study that looked at the labels that show the effects of smoking to yourself, the smoker, versus showing the effects of your smoking to someone else, such as children or non-smoking adults. And it found that smokers rated the effects to others as higher. But that was just one study, and so further research is needed to investigate that. And the literature has been very mixed on the use of testimonial narrative formats and the use of gain versus loss frame messages and labels. So testimonial narrative formats are labels that tell the story of a person, often who's suffering from the negative health effects from smoking. It has a quote from them in quotation marks, along with their name and their age. And some research has shown that those testimonial labels are rated higher. Other research has shown they're rated just as highly or less highly than normal didactic style labels. And then other research has looked at gain versus loss frame messages. Gain frame messages being what do you gain by quitting smoking versus loss frame messages, what do you lose, what are the risks of continuing to smoke. And again, there's been some contradictory findings on which is more effective. And last, the last gap, which really drove a lot of my research questions, was there's a limited use of communication and behavioral theories in the design and the exploration of graphic warning labels. And so, for example, the extended parallel process model is a risk communication theory. It's been used in a lot of health communication campaigns and has received a lot of attention in the literature. There's a scientific basis behind this theory. And according to this theory, in order for a health communication message to be persuasive and to influence behavior change, it needs to have two components. First, it needs to have a threat message to it. And that means it needs to show the severity of the disease as well as your susceptibility to getting that disease. So for example, in the case of a warning label, it should show the negative effects of smoking and that those effects, those health effects, are severe and that you are likely or vulnerable to getting them. So according to this theory, the threat on a message motivates people to act by creating fear. But what action they could take two different types of action. One is they could try to control their fear by avoiding the labels, just not, some sort of defensive action to not have to think about it. Or they could take an action, the recommended action, such as quitting smoking. And what determines what action they take depends on the second key property, efficacy. Efficacy has two dimensions. One is self-efficacy, which is just your ability to perform the recommended action. So in this case, your ability to quit smoking. And response efficacy, which is the effectiveness of the recommended action to reduce your risk, such as does quitting improve your health? So for example, with a graphic warning label, to have an efficacy message, it should impart information to the smoker that they have the ability to quit and that by quitting they will reduce their risk. So if we think about this in the context of graphic warning labels and what we already know about graphic warning labels, the literature shows that the labels do elicit these emotional responses, including fear, which the model says is key to motivate action. And in fact, the fear from these labels is associated with intentions to quit and cessation behaviors. However, there's been limited research on the efficacy beliefs and the impact of the labels on people's efficacy beliefs. And the research that has been done has shown little or no impact. But that's largely due to the fact that these labels haven't developed efficacy messages. They've looked at current labels to see what impact do these labels have on efficacy beliefs. But there's a lack of actually trying to figure out what's a way that we can communicate efficacy to a population via a label. So there's a need to study and to explore and to test efficacy messages on labels. In addition to risk communication, there's another really helpful theoretical construct that we can borrow from health communication literature called perceived similarity. And this construct is really just a person's judgment of his or her similarity to a character who's portrayed in a message. For example, if you're looking at a character on a graphic warning label, how similar do you think you are to that character? And the health communication literature has shown that if you perceive yourself as similar to a character, that can increase the message's persuasiveness, information retention, and favorable attitudes towards the message. And in turn, this can promote and increase your perceived susceptibility to the health risks, self-efficacy to do a recommended action, and modeling of the character's behavior. So we think about this in the context of a graphic warning label. If I, as a smoker, perceive myself as similar to a character who's on a label, and that character on the label is suffering some health consequence from smoking, I'm more likely to think, oh, that person is similar to me, and they're suffering from these negative health effects from smoking. I'm susceptible to also having those health effects. And in turn, if you see a character who has been able to quit smoking, if you perceive yourself as similar to that character, that's more likely to increase your confidence that, that character who's like me, they were able to quit, so I could do it too. So you can see how perceived similarity could have a significant impact on how persuasive the labels are through people's perceptions of the characters and their perceptions of similarity to the characters. So how do we judge our similarity to characters? There's multiple dimensions from this that we found in the literature. You could judge your similarity based off of personality. Do they have the same personality as you? Beliefs, values. Also, there's some evidence suggesting that demographic trait concordance. So I feel I'm more similar to another white female who's of my age, for example. So the literature shows perceived similarity can have a significant impact on message persuasiveness. But this hasn't been explored with the graphic warning label research. And even more broadly, there hasn't been as much exploration of the perceptions of characters on the labels. They've looked at perceptions of the labels, but thinking more specifically about the characters could be highly useful for evaluating and designing persuasive labels. So just to summarize the rationale for this research, First, there's a need to design and explore new graphic warning labels, both to inform the FDA in designing and developing and testing new labels, but also globally, we found that wear out of labels does occur. They lose their effectiveness over time. So there's a need to rotate new labels. And so there's a need to think about new ways and effective ways for designing labels. There's been limited research conducted with low SES populations, as well as limited research on what the most effective content of labels are. And last, there's a lack of theory-driven design of these labels. And in particular, there's a lack of efficacy message property development and exploration, as well as perceptions of similarity to the characters. So overall, my research aim was to explore perceptions of theory-based warning labels and their role in risk perceptions, efficacy beliefs, and motivation to quit among low-income smokers in Baltimore. This is just to graphically show you the specific aims of the study. So on the left here are the graphic warning label components that I was interested in exploring. So first, I was interested in the level of threat that these labels portray and the inclusion of a self-efficacy message or a response efficacy message. And for my first aim, I explored the role of these three components on risk perceptions and self-efficacy beliefs in this population. For my second aim, I was interested in their perceptions of the characters, and when I was designing these labels, I purposely selected characters that had a range of demographic traits, and I wanted to explore that in their perceptions of similarity, and in turn see, does perceived similarity play a role in their risk perceptions and self-efficacy beliefs in the context of these graphic warning labels. And my third aim was to look specifically at the content of the labels, and I conceptualized that as labels that show the positive effects of quitting for the smoker or for others, and the negative effects of smoking on the smoker and others, and looking to see what role that plays in their motivation to quit. So my study population was 25 low-income smokers in Baltimore. I did the study with adults age 18 or older and current cigarette smokers, and that was defined as they had smoked at least 100 cigarettes in their lifetime, and they'd smoked in the past 30 days. My population came from a community-based source population. It's from a study that's currently going on in Baltimore. The PI is Dr. Carl Latkin. For my study, I purposefully sampled from that community-based source population to get an equal distribution of gender and age group. And I wanted to, I used 40 years as the cutoff. So younger smokers who were younger than 40 years and older smokers who were 40 years or greater. And that was really just so that I could capture any potential variations in their health concerns by age and gender. I conducted one qualitative in-depth interview with each participant, and they lasted about 1 to 2 hours. The topics included, I showed them these labels, and they told me we discussed their cognitive and emotional reactions to these labels. And I asked them to show me which labels they thought showed the most harm from smoking, so tapping into that perceived severity that we talked about earlier, which showed a health effect that was likely to happen to them if they did not quit, and also ones that made them worry the most about their own smoking, so tapping into that perceived susceptibility construct. I asked them to show me which ones made them confident that they could quit, so which ones played a role in their self-efficacy beliefs, which showed a character who was similar to themselves, and last, which were most likely to motivate them to quit. So I developed 12 graphic warning labels, and with permission, I obtained these warning labels from Australia, Brazil, Canada, and from the 9 FDA graphic warning labels that were approved originally, but now they're not going to be used. And I also developed some new labels as well. And these labels I adapted so that they showed a variety of threat levels, efficacy messages, demographic traits of the characters, and the content. And I'll show you some examples now. So for example, we know from the extended parallel process model that threat is needed to motivate action. But the literature on the graphic warning labels showed us that some, the vivid pictures, these high threat, what I classified as high threat on the left here, those tend to be rated as most effective, but there's a lot of variation in that. There are smokers who view non-vivid pictures as most effective. So I wanted to include both. So I have the high threat labels that have vivid pictures of the negative effects from smoking, and low threat labels that show a non-vivid picture of the negative effects from smoking. And then I include a no threat category, which has a positive picture, doesn't really show the negative consequences of smoking. I also developed, using theory, I developed response efficacy and self-efficacy messages So again, response efficacy is the effectiveness of a recommended action to reduce your risk. So I chose to focus on the effectiveness of quitting on improving your health and also your family's health. So in the example here is of your children's health. And also the effectiveness of calling the quit line on helping you to quit. I developed 3 types of self-efficacy messages. And this is one example here. So these self-efficacy messages were designed to increase people's confidence that they could quit. And in this example, this is a social modeling self-efficacy message. So it shows a person, Michael, who was able to quit and how he was able to quit. So he's serving as a model for people, and hopefully, theoretically, they can vicariously experience his quit success, and that would make them feel more confident in their ability to quit. Again, I varied it based off of the demographic traits of characters, so I tried to include a variety of races, genders, and also age. And for my third aim, I was interested in the content. So I had 4 labels that talked about the negative effects of smoking to the smoker, such as the risk of getting emphysema, the negative effects of smoking to others, which included babies, like in this example, children, and non-smoking adults. 2 labels talked about the positive benefits of quitting for the smoker, such as reducing your risk of cancer, and the positive benefits of quitting for others. All of the interviews were audio recorded and transcribed, and I analyzed the transcripts in the software Atlas TI using the framework method. The framework method of analysis is really just a type of thematic analysis in which you use a matrix structure to systematically reduce qualitative data. And that really just means I had a very large table, and I summarized the data by participant, by label, and by theme. And that helped me to identify patterns within the data. And in addition to that, it really enhanced the rigor and transparency of my data analysis. And for coding, I used a combined deductive and inductive approach to finalize the coding scheme with input from 2 of my co-authors. My 25 participants were on average 45 years old. Most of them, 22, were African American, and most had a low level of education, were not employed, and were low income, meaning they made less than $10,000 in the previous year. Most of them, 23, reported smoking every day, and on the days that they did smoke, 11 said that they smoked less than 1 pack per day. 14 said they had tried to quit at some point in their lives, and 11 said they had tried at least once in the past 12 months, and 8 said they were currently trying to quit. So my first aim was to explore perceptions of graphic warning labels with threat and/or efficacy messages and their role in risk perceptions and efficacy beliefs. So my first main findings was that those high threat labels, the ones with the vivid pictures of the negative effects from smoking, participants reported those as most influential to their risk perceptions, their perceptions of the severity of smoking and susceptibility to these health conditions. And when we talked about it, the reasons why were the picture, the highly vivid picture really influenced them. They had negative emotional reactions to these labels, including fear and anxiety. And they also found these labels to provide very clear information, and some of the information was new to them. So that was also highly influential that they reported on their risk perceptions. As this older man stated, because you wonder how close or how far you is to being that way. So if like you're a little concerned, a lot concerned, you wonder how close you is to being like these people. You might don't even know it. So you can see for him, this really highlighted for him that perceived susceptibility, and am I at risk for getting these conditions? I also found that vicariously experiencing characters' quit successes, they reported that as most influential to their self-efficacy beliefs. And the reason for that was twofold. One, these characters served as role models to them for quitting. They see someone else who's able to quit. That makes them feel more confident that they could quit as well. But also, there was kind of a response efficacy piece in here that these characters were healthy, and they also showed the social benefits of quitting. So those labels that show, a happy family together or a happy spousal relationship, it shows that by quitting, maybe it would improve or that their partner would be happy. So about this label, for example, this older man said, he looks at his quit date and get rid of all his cigarettes. I think I can do that. When I really, really feel like it needs to be done, which is now, I think I can do that. So you can see he's looking at Michael and how Michael was able to quit. And that's making him think, well, if Michael's able to do that, that's something I could do now, and it's something that I need to do now. So you can see how vicariously experiencing Michael's quit success played a role in his confidence and his self-efficacy to quit. For the second aim, I wanted to explore participants' perceptions of their similarity and also their dissimilarity to the characters on the graphic warning labels, as well as really their overall perceptions of these characters. So when I asked them which characters were most like you, some of the most commonly reported reasons for the characters that had quit and looked healthy after quitting, they really aspired to be like those characters. And for the characters that had health conditions already, they felt they were similar to them because they also have those health conditions, or they've also had that kind of medical treatment in the past. For example, one label showed a man in the hospital, and that made a participant think about a time when he had also been hospitalized. Some commonly reported reasons for dissimilarity to characters was, one, they don't have those health conditions, that's pictured on the label, and two, the labels that showed that happy family and romantic partner relationship, they couldn't relate to that because they don't have those sorts of supportive relationships in their own lives. So for example, about this label, this older woman said, "This has given me a message that quitting smoking will improve my health. I want to look healthy." So she identified him as someone she felt similar to, and the reason why is because she wants to be like him. She wants to quit and she wants to be healthy and look healthy like that. About the same label, this younger woman said, "I know I can quit if I want to," but it's like, yeah, looking at him, I'm like, if he can do it, I know I could do it. So she picked him as being similar to her, and you can see how that perceived similarity played a role in her self-efficacy beliefs or in her confidence that she could quit. Seeing this person who's like her made her feel like, well, he was able to do it, then I could do it too. And about this label, an older man said, "Well, he's going through some conditions that I'm going through right now. I'm just not in the hospital at this particular time. So if I don't stop finally, I will be in maybe his next phase of being seen by the hospital." So this man he reported himself as similar to this man in the hospital bed. And you can see the role that played in his risk perceptions. By seeing this person he identified with in the hospital, even though he's not currently in the hospital, it's making him think about the future and about his own future susceptibility and likelihood of being in that situation. So these quotes illustrate how perceptions of similarity can play a role in both self-efficacy beliefs and their risk perceptions. Also, a topic that came up was the credibility of the characters. And some of the factors that affected whether or not they found these characters credible were, first, was it real people or were these just actors who were being paid to take the picture? Second was the authenticity of the emotions portrayed, and that really came up a lot with some of the positive labels showing the benefits of quitting. If someone looked happy after quitting, that seemed authentic, but if someone did not look very happy after quitting, they didn't think that was very authentic, and so that affected the credibility of the characters. Also, if a label didn't provide enough information, that also affected the credibility of the characters. So for example, this younger woman said about this label, "Well, like I said, this could just be a front for this picture. Who's to say these people are really happy? They probably got paid to take this picture." So you can see how there's a need for some very careful testing when you're developing these labels and selecting pictures and having people in these pictures. For this woman, she discredited this label. It was not persuasive to her, and part of that was because of the characters. She didn't find them to be very credible. The third aim was to explore the role of graphic warning labels in motivation to quit, and looking specifically at those categories of content. Go through that now. So when I asked them which labels were most motivational to them, they reported that the labels showing the negative effects of smoking to themselves, to the smoker, that was the most motivational. And that was followed by showing the negative effects of smoking on others. And in particular, it was on children and on babies. And the reasons for that were these labels increased or had a role in their risk perceptions. They perceived that these health effects were severe and that they or the children were susceptible to those effects. They had negative emotional reactions to these labels, including fear and anxiety. And about the labels for effects on others, they talked about a general moral duty to care for children, that they're obligated to care for children and not smoke around them and cause disease. And that was true even for people who didn't have children. For example, this younger man said about this label, "I mean, you know it's harming you, but you don't know it's harming you to this extent. When you actually see a heart like this, you just be like, wow, it really makes you think." And he actually went on to say that he's not going to enjoy smoking as much after looking at these labels. So this label is something motivational to him, and the reason why it was making him think about his own risk, and is my heart also looking like that? And it's making him think very hard about quitting or about what smoking's doing to him. Participants also reported, not as frequently, but a subgroup of them did report that the benefits of quitting for smokers and for others was also motivational. And the reason for that was these labels provide hope for them. They viewed the characters as role models to follow for quitting. And they also expressed this desire to improve familial health and create stronger familial bonds. And in the interviews, they did talk about their relationships with their families and with their romantic partners. And many of them had a desire to improve those relationships. And they did talk about quitting as one way to improve those relationships. So these labels really highlighted that for them. And then I also asked them why the labels might not be motivational for them or motivational for others. And they said one was the lack of impact on their risk perceptions. It just didn't look like there was any harms from smoking on some of the labels. It didn't make them feel susceptible to those effects. Also, low credibility played a role in whether or not labels were motivational. And last, there was a subgroup who talked about disease as part of fate. And even if you quit, you're still going to get a disease. And so that could perhaps, look at maybe it's a fatalistic attitude, or maybe these people, they just don't feel like they have a lot of agency in their own health and their own health care. So for this population, these labels were not as motivational for them because all these labels focused on the health issues from smoking. An interesting finding also emerged that there were some differences in responses by their quit attempt status. So people who had never tried to quit in the past and people who said they were currently trying to quit, they reported that all these types of labels were motivational to them. However, if we looked just at people who had tried to quit at some point in the past but they weren't currently trying to quit, they said the content about their own risk was much more motivational. And the effects to others was also somewhat motivational, but it was really their own risks. And none of them reported that content about the benefits of quitting was motivational. So you can see how quit attempt status might impact persuasiveness of the labels. So just to sort of integrate all this together across all three aims. So first, the high threat labels, those labels with the vivid pictures of the negative effects from smoking. Found that they influenced perceived risk from smoking, and they caused people to have fear and worry. And in turn, these emotional reactions and these risk perceptions they reported these as motivational to them for quitting. I found that vicariously experiencing characters who were able to quit, they reported that as most motivational to their self-efficacy beliefs, and also that was motivational to them for quitting. Third, there was this discussion of aspiration to be like these characters and to emulate these characters. And then other factors affecting perceived similarity, such as shared health status, these were influential. The aspiration to be like the characters was influential on their self-efficacy to quit. And then some of these other factors, like shared health conditions, influenced their perceptions of susceptibility to these conditions. And then last, the credibility of the characters influenced both their perceptions of similarity to characters and the motivational impact of these labels. So from this, I wanted to think about what are some recommendations that I could make for future exploration and design of labels. So first, from the findings, the depiction of on a label, if a label depicts the progression from someone suffering from the common minor symptoms of smoking, such as a smoker's cough, and then showing that person progress to a more life-threatening outcome, such as emphysema or lung cancer. That might be a highly motivational label based on these findings. And first, it has to do with enhancing people's perceived similarity. So if people felt that they were similar to people who had a shared health condition that they had. So if you show someone who has a very common minor symptom, such as a smoker's cough, they might be likely to perceive themselves as similar to that person. And then by progressing to a more life-threatening outcome, you could potentially increase their perceptions of risk, saying, oh, that person who's like me, they had a smoker's cough and now they have emphysema. I wonder if I'm also susceptible to that. And in turn, these findings showed that those risk perceptions were motivational to people. So it could potentially improve or increase their motivation to quit. Second, a label could compare a healthy character whose health improved after quitting, compared to a character who didn't quit and is still suffering from the negative effects from smoking. And the reasons that might be effective is it could increase people's risk perceptions by showing the negative consequences of smoking, this unhealthy character who didn't quit and is experiencing deteriorating health. And then contrasting it with a healthy character, someone who was able to quit, and someone who looks healthy after quitting. So you can kind of tap into that aspiration to be like the healthy character and perhaps influence their efficacy beliefs and their motivation to quit. Last, those socially oriented labels, those ones about the effects of your smoking or of quitting on other people, those are motivational, highly motivational for some people. And these could be a promising approach to motivate cessation. For example, a previous study has shown that people who have never tried to quit in the past, they tend to be motivated by thinking that their family wants them to quit. And we also found, in this study that those labels about the effects of quitting on others, that was motivational for people who had never tried to quit before. So these socially oriented labels could potentially motivate cessation in populations, and in particular, people perhaps who have never tried to quit. The last recommendation for a label, the testimonial narratives from former smokers, those labels that use that approach could potentially promote self-efficacy beliefs and motivation to quit. So a lot of labels now, well, not a lot, but some labels now use testimonial narratives from people who are suffering from the effects of smoking. So on the other side, you could try testimonial narratives from people who are able to quit and who look healthy after quitting. And the reason for that is they can serve as role models for quitting. They could help, if you use real people, they could overcome doubts of characters' credibility. And then this portrayal of healthy, happy characters can influence aspiration to be like those characters and to quit like those characters and be healthy. In terms of future research, experimental studies with a longitudinal follow-up should be conducted to test the effectiveness of these proposed new label designs and see if they have an impact on cessation behaviors. And also, before graphic warning labels are implemented, I think it's necessary to do qualitative exploration and testing to verify character credibility. So kind of a greater focus on the characters and the credibility of the characters. So some of the limitations of this, there might be some limited transferability of the findings to other populations. This was done with one urban population in Baltimore. It might mean that the findings have limited transferability to urban settings or other urban settings or rural settings, for example. There's potential for social desirability bias because of the stigma attached with smoking. Although these participants, they're from contexts where smoking is highly prevalent, so it might not be as much of a bias with this population. The labels were done where were exposed to labels in one time in a clinical setting, so it did not mimic a real-world setting. And the cross-sectional design precludes any estimations about causality or changes because of the labels. But I think that the use of these well-established theories in the label development and exploration of the perceptions might enhance the theoretical generalizability of the results. And the use of the understudied population, I think, is a significant strength. And the qualitative methods allowed for kind of contextualization of the responses. So based off of that, I just have a few minutes left. I wanted to leave enough time for questions as well. Based off of the qualitative findings, I wanted to look at the testimonial narratives from former smokers, and could that be a potential avenue to increase and promote cessation or cessation-related attitudes? So the parent study is currently doing a quantitative test of 13 graphic warning labels, and so based off of my qualitative findings, I designed 4 labels that are narratives from former smokers. And I wanted to present to you some of the preliminary findings and get your thoughts and feedback on that as well, since this is an ongoing data collection. So these are preliminary results. The study population is the same. It's a community-based sample in Baltimore of low-income, predominantly African-American smokers. And for this quantitative study, they're first administered a survey, and then they rate these 13 labels one at a time on 6 to 7 items. So there's 137 participants enrolled. And they rate the 13 graphic warning labels based off of to what extent the labels make them feel worried, grab their attention, are believable, are relevant to them, make them want to quit smoking, and to what extent they make them feel confident that they could quit if they wanted to, so kind of tapping into that self-efficacy belief. And the labels that showed pictures of people's faces also asked them how similar they feel to the person in the picture. These are the 4 labels that I designed based off of my qualitative findings. So they're all testimonial narratives from people who were able to quit, and I varied it based off of gender and race as well. And this is what I'm calling the standard quit now label. This is what's typically used for if it's not about risk perception, not about threat, just trying to motivate people to quit by showing a person, I guess, who's able to quit. And then the last 8 labels show a variety of high threat messages. So again, those vivid pictures, and low threat messages that use non-vivid pictures of the negative effects from smoking. So this graph just compares them based off of some of these criteria that they rated them on. So the bar on the far left, the dark blue bar, that is that standard quit now message with the guy holding his shirt open. The next one, the green one, are the testimonial quit now labels that I designed based off of the qualitative research. The third column is the low threat labels, and then the last column is the high threat labels. So you can see a general trend. Again, these are preliminary results, and it's the percent of participants who rated the labels on these criteria. They're dichotomized, so it's the percent who rated it as very or extremely making them feel worried, for example, or grabbing their attention. So you can see a general trend that the high threat labels tend to be rated the highest, followed by the low threat labels. And the testimonial ones tend to be rated higher than those standard quit now ones. But again, preliminary results, and the goal is to get 250 people by the end of this. So it's only about a little more than half the sample. But there is one interesting trend I wanted to point out, and that's the confidence to quit. To what extent does this label make you confident that you could quit? So again, the high threat label is rated highest on this compared to that standard quit now message and the low threat labels. But at this time, there's no statistically significant difference from the testimonial quit now labels. So just based on these preliminary results, it appears that perhaps the testimonial quit now labels might be as effective as the high threat labels in increasing confidence to quit. But the trend is, the high threat labels are still rated by more people as effective. But currently, there's no statistically significant difference. But once all the data are in, we'll have to revisit that and see if that trend continues. So the next steps would be looking more, once all the data are in, looking at the associations between the content of the labels and the ratings on worry and attention. And then I also want to see if perceived similarity to the characters on the labels modifies that association. If they feel more similar to a character, do they tend to rate it higher? And I'm also interested to see if some of participants' baseline characteristics, such as their risk perceptions and their efficacy beliefs and their quit intentions before they see the labels, does that influence which labels they respond to more? So in conclusion, the study identified some key factors that influence the effectiveness of the graphic warning labels, as well as providing some new areas for research and further development. It supported the use of well-established evidence-based theories, which has been used in a more limited capacity in the current graphic warning label research. And it showed how these can be used to potentially enhance label effectiveness by influencing risk perceptions, efficacy beliefs, and motivation to quit. And last, because we did this study with a low-income population who suffer from some of the highest burden from smoking, it might help to address some potential barriers or suggest new ways for the labels to have an impact in this population. Thank you very much. So I'd be happy to take any questions.
So I haven't seen this before, but with that quantitative study, I didn't understand your conclusion.
Okay.
It's like it's all on high threat.
Right.
It's better on every, obviously, this is only a small, or this isn't the whole sample, but it looks like it's on every domain, it's better.
Yes, yeah. And that is supported in the other graphic warning label literature that these vivid pictures tend to be rated highly. Again, the literature has shown there is some substantial variation in that, so it would definitely, but that hasn't been done with this population really as much before. So it's definitely worth, once all the data's in, to look at that more carefully. So really it's just to see, do these testimonial labels, could they also be a potentially, good way to design labels or a promising way to affect change?
But why do you say that? Because, I understand the qualitative results, but at least from this, it's like there's no way that they are any, they just don't look as good as the high threat testimonial.
Right. No, I'm not suggesting using them instead, only using testimonial. I think the best approach is to use a mixture of different messages. And in particular, I think there's a need to see what type of messages might work with different populations better, just to sort of have a variety and make sure you're having labels that speak to different populations. So I,
Just to be
yeah.
clear, so the high threat one was a woman who had lung cancer, said, look at this face. Is that high threat as well?
Yes.
So that's also testimonial.
Right.
Did you count it both? But how did you, in that slide you just showed us, you counted it as a high threat?
Right, because the two types of testimonial labels are qualitatively different. This is a testimonial about the negative effects of smoking. And, for this preliminary, for this presentation and just looking preliminarily at the data, I was most interested in saying, okay, how do these more positive testimonials from former smokers, how do they match up? How do they compare? What kind of influence do they have? But definitely for a next step, once the data are in, I would like to compare the two types of testimonials.
Just one more question. Why? But so will you be able to do a 2x2 table that looks at threat and testimonial? Threat, high, low, testimonial, yes, no, and sort of factor out testimonial versus threat?
I think so. The problem is there's only 13 labels. And there's one testimonial that's high threat, and there's one testimonial that's low threat. So I'm not sure, if you can make that 2x2 table, really. You only have one of each, and then for the more positive ones, there's only one label that's kind of more positive about benefits of quitting that's not a testimonial. So you could do it, but yeah, I guess there's caveats with that since there's only one label in a lot of these categories. In the back.
I have a question about the physical representation of the labels on the packs. So your testimonial and your high threat labels have a lot of textual content.
Mm-hmm.
Have you been able to see how that actually looks on a tobacco pack? Because I know it might be hard to actually read that, depending on how much space you have to take up on the pack itself.
Right, and we did not put the labels on packs, so we didn't see how ours looked on packs. But some countries, some countries do have elaborated text on the sides, like this one here with Barb Tarbox. That's a Canadian label. So some of them do have it on the side, and that's a really good point because the tobacco industry has also, realizes that if they change some characteristics of their pack, that could make the warning labels, distorted or very small. If they start making very small packs, that can make it very small and hard to read. So it's definitely a consideration. And I think some countries have thought about, they put inserts into the pack, so there's more, so the label kind of grabs your attention, and then there's some more information on the insert. These labels are also supposed to be on the front and back, so I think one country has this on the front, and then on the back they might have more elaborated text. So it's definitely a very valid concern and something to think about. Right?
Yeah, this is really interesting, and I really like how your qualitative work informed your quantitative. On that same slide that was showing your quantitative results, you grouped the very and extremely, and
Yeah.
I know that this is halfway through the study, you have a lot more data to get, but I wondered, can you learn anything from the other tail? I wondered about the distribution, and if there's some characteristics of those who just are not, they're rating it as very, unlikely.
Mm-hmm.
Can you tell us a little bit about the shape of the distribution?
Yeah, and it's interesting because it differed. I was trying to make them so that they could be equally comparable. But for example, the low threat labels that were believable, they had a slightly different distribution. They tended to be a little on the lower end, whereas a lot of them tend to be more people tend to be in the very or extremely end. But there are definitely some exceptions to that pattern. So I think it's I'll have to look at that in the next stage.
We might be able to find something,
Yeah.
at least with some of those characteristics that are associated with the lower end.
Yeah, thank you. I'll have to talk to you when I'm doing that. Thank you. In the back.
Yeah, actually I saw this similar study like this. Joanna is over there. She
Yes, thank you for that question. So the question, and for people who might not have heard it, was usually for these criteria, typically use a 10-point Likert scale, and we chose a 5-point Likert scale. And the reason for that was our population. The Parent Study has worked with this population a lot, and we actually piloted some other different questions using a 10-point format. Not these about the labels, but in the survey we would ask some questions on a 10-point scale as part of the pilot for the survey. And we found they had a lot of difficulty with the 10-point Likert scale, and in previous studies also, the PIs know that they have some more trouble with the 10-point scale. And so we decided to go with a 5-point scale for these surveys based off of that experience.
I have a question about some of the policy implications that you had listed, specifically thinking of designing warning labels that either show progression from mild to severe symptoms or disease, and then sort of show like a successful quit attempt. And just, I'm wondering, like, I'm curious if beyond the warning labels that you used for this study, if you're aware of any like countries or jurisdictions that have taken that approach already. When I think of that, I know we see that probably more often in like mass media campaigns, just 'cause we have more time and space to
Right.
sort of give that narrative. But I was curious if you know of any areas that have attempted that yet, or if it's sort of yet to be designed.
Right, and I think you're bringing up a really good point too, that these graphic warning labels are limited space. So, some of those suggestions, for example, comparing an unhealthy character to a healthy character on one panel, I don't think would work because of the size issue that you brought up before. But these labels are supposed to be on the front and the back, so I thought if it's possible, you could have one on the front and one on the back, for example. And I'm not aware of, there might be some other graphic warning label experts in the room who can answer that part too. I'm not aware of any countries doing that. What I am aware of is someone I spoke to, I think she was at UPenn. They've also started to develop warning labels that are testimonial narratives from former smokers. And they're from real people, from real former smokers, and actually trying to develop. So when I spoke to her a few months ago, that was an idea that she was working on. So I think that would be very interesting to see.
I was curious about that, because you did speak about that your participants talked about the characters more so being actors. Did they state whether or not they felt that was an issue amongst your high threat versus your no threat at all? Because some of your no threat at all, you have like a happy family versus, say, a testimonial. This person looks sick. Did they feel like that person, where they more so may have resonated with their experience, was also an actor?
Yeah, that's an interesting point. I'd have to go back and look more closely at that, but just from what I know now, no, I didn't see any particular pattern with that. In terms of general credibility of the labels, not just thinking about the characters, but the picture that was of a gangrenous foot, that was new information for a lot of people, and that's a very vivid, startling picture. And so there were some participants who did not believe that was true at all. So not even just talking about the character, but the label. And it took them some time to get acclimated to it. Sometimes they would like put it upside down and push it away. And after a while, I would like bring it back out again. But it took them some time to sort of come to terms with that as being an actual health effect. And most of them after that was only a few people, I'd say. A lot of them had a strong reaction to it, but one of them, I think, still would not believe it, but the rest of them did actually start to believe it. So I think those high threat pictures are something, if it's so vivid, that could, create this defensive action. And that's why these efficacy properties are so important to, try to stop that defensive action, actually get people to think about it and to think about, what they can do and to reduce their risk. I think that label of the happy family, that was one that was talked about a little bit more as not being credible, just because everyone looks very staged and posed. So I think when you're developing these labels, these pictures, you have to think about that and get some initial thoughts from people about the pictures and what they look like, and thinking about how that might influence the persuasiveness. Okay, thank you everyone.